Omicron variant. The country detected the new variant as citizens were already, being warned about the impending fourth wave. And now South Africans are waiting with bated breath to see what the government's next move will be. Since the pandemic reached our shores, people have been adjusting to the different levels of lockdown as a result of the numerous coronavirus waves and variants. A study conducted last year by the South African Human Science Research Council, found that COVID-19 has had a significant impact on mental health in South Africa. To what degree, though? Let's discuss this and bring in clinical psychologist Professor Saths Cooper. Prof, great to have you on the program. Welcome.
Pleasure, Blair.
So the coronavirus, it has necessitated widespread lockdowns to mitigate the pandemic. COVID-19 related stress and lockdowns, economic disruptions. What impact is this having on mental health?
Well, I think indelibly it's impacted all of us in different ways. The kinds of research done not only here but elsewhere show that there's a pervasive feeling of almost hopelessness. And if you like, because of the situation we find ourselves in, the socioeconomic and political situation of insecurity, one of helplessness, I would imagine. There's clearly a fear of infection, and people are very, very uncertain. And every few weeks, if not a few months, we get buffeted by some new understanding of what needs to be done with lockdown levels and layers of differentiation. I think it's all getting very, very confusing, and there are going to be reactions from a lot of people. As it is, we've seen lots of anger. We've seen a certain level of frustration building up. You spoke about coming here just after or just before Christmas, and we're going to enter our second Christmas under these pandemic conditions. Human beings are social. We get our humanity, not only from ourselves, but importantly in interacting with others. And in our country, we are fairly good at getting together at the end of the year. So from the second week of December, we have our own lockdown, if you like, with our family and loved ones and friends. And this will be the second time where we're not going to have that degree of celebrating each other, let alone Christmas. So it is a time of immense stress. But look, there are ways of dealing with the stress, and certain stresses affect some people more than they do others.
Yeah, let's talk about that. We are no doubt facing challenges that can be overwhelming, and you see it all around you. It tends to be strong emotions, not only adults, but children as well. People have planned their holidays already. Now they fear that things might change if we go into a harder lockdown. They have had a tough year, Prof. Many looking forward to, as you say, getting together with their family, friends, relaxing. Talk to us about those coping mechanisms. How can we cope with the stress and anxiety in a healthy way?
Well, look, I think one thing that has happened is we use more electronic devices. All our phones are used much more. The cell phone companies in this country make a fortune from our lockdown conditions and our need to communicate with one another. However, that communication, even if we see the person's face on our screen, as you and I are talking right now, it's not the same as that human contact. We crave that human contact. And we should recognize that for a significant percentage, almost, I would imagine at least half of this country, people live in urban areas, they live in cities and towns, but they tend to go home to a village, to a place that is different from the work environment. So we have this massive migration back home, if you like, leaving our urban places where we live to that place which gets the family together. Now, those things are not going to happen in the same way. And I don't think that any announcements are going to lessen the burden. But we should also remember that the politicians added to the crisis. Besides what Ms. Sophie has said, for ourselves, our politicians held rallies with a gay abandon. I don't think there were limitations on those crowds. So you can expect that they, like other politicians in other places in the world, contributed to our next wave. So we can talk about, new variants, etc. But until we have a population that is more civic-minded, more caring about others and self, and taking the vaccine, because that's the only antidote we have right now. And the science is very clear. The hesitancy amongst our people is one that we should be really breaking through, because if you looked at the local government elections, the majority who went and voted were also civic-minded and took the vaccine. So now we have a situation where there's underutilization of the vaccine. So who do we blame? I think we need to look at our own behavior in these circumstances as well.
Well, consequences are in part a function of speed of process. It could be a good thing, it could be a bad thing. When governments around the world react in a manner that catches the public off guard, or society doesn't agree with that process or the envisaged result, vaccine mandates, for instance, travel bans, what sort of emotional or physical tension this creates in society?
Well, look, it's going to affect middle-class people, you and I, who have planned to go somewhere, and the more wealthy people who have planned to go overseas and so on, or people from abroad coming here. So that impact is going to be within a slice of the society. But the gatherings that the majority of people are likely to have thought about for this Christmas are going to be really limited in many respects. Otherwise, we will continue to be infected or infect one another. And in those gatherings, we don't have the kinds of precautions. We don't mask unless we are eating, and then we should be masking again. We don't do those things. We think it'll just disappear. So I think we need to learn that this COVID pandemic, this epidemic is going to remain with us for a very long time. And unless we buckle down and take care, particularly of those who are vulnerable in our midst, older people, our grandmothers, parents, we need to ensure we don't infect. Remember that last December, there was that rage in Durban, and a few matriculants went home and effectively killed their parents. So that's the kind of thing we need to appreciate, and children and teens in particular need more attention. People who are at the front line, the healthcare workers, first responders, people who have other mental health conditions, and then those amongst us who tend to worry. We are warriors rather than warriors. We tend to worry about everything. So I think we should take note of the information, but also sometimes information overload can actually freeze you. You can get frozen, and instead of fighting something, you're going to get immobilized by it. So we need to learn better coping strategies, and those mean psychological as well as physical. So those there are decent ways in which we can deal with it for ourselves and for those around us.
Just to wrap up our conversation, Professor, and having said what you said, is it going to be a mission not of science, but of messaging in getting us to a better place?
I think you've hit it on the head. I think all of us who are involved in this, you in the media, in the electronic and other media, need to overwhelm the social media nonsense that passes for expertise, because you get instant experts who claim this happened to me, I know this, I know that, but no name, no research, no peer review. You see, I can research something, Blaine, and say to you, in my house, 1, 2, 3 children respond in this way. But unless that is tested against other families with similar circumstances, my notion of what happens in my family means very nothing to anybody else but my family. It may be true of my family, but I can't extrapolate that to the rest of society. So now is the time when we need to be more careful, be more caring for those around us, and heed good advice. I hope the president takes a leaf off his own advice when he addresses the nation and understands the difficulty our people have. So, for instance, the politics associated with our being the first amongst the first countries to identify, sequence this new variant, and then get blamed for alerting the world. That kind of thing, I think, needs good journalism to show the chauvinism, to show that colonial mentality that still prevails out there. And for ourselves, we need to look after our children. We need to make sure that our children are growing up in an unnatural situation. Over the last 2 years, more children are going to have less contact, and heaven forbid that they grow up thinking that this is normal, that I only interact with my caregiver, my one-on-one with my parents and so on, rather than other children and other adults. So when kids are going to grow up in this kind of closed environment, we're going to get agoraphobia. They're going to be fearing interaction with others, and that is not good, because we are human beings. And the sayings in our local languages are absolutely appropriate. We become human through interaction with others.
No doubt we have to surrender the me for the we. This virus is not going to go away simply because we're tired of it. Fatigue doesn't equal progress. Professor Saths Cooper, we appreciate your perspective. Value added, and a plus to the audience. Thank you very much indeed, sir.
Thank you.
All right.